Good afternoon. So, uh, sometimes my life writes its own story in the news, and I don't even know it. And I have to look at it and go, "Hey, I know all about this." Uh, I was a paramedic for a long time, as everybody knows, and when I went to Texas, I became assistant chief, and my chief, his name was John Kay. He was a hell of a guy. I love that guy. He's passed away now, but he was the president of SETRAC, which SETRAC is. Hold on, let me pull it up. SETRAC is the mission of the Southeast Texas Regional Advisory Council is to develop and sustain a powerful coalition of providers, responders, and healthcare related partners united together to save lives and improve health outcomes through research, education, and collaboration. The Southeast Texas Regional Advisory Council will provide leadership within our state, region, nation regarding the care of trauma patients and the solution preventable mortality and morbidity. The goals is to promote external communication to our constituents through public awareness, educational resources, prevention programs, identified and integrate our resources as means to obtain commitment and cooperation. You can read the rest of that. Establish system coordination. Let me start over. Identify leverage tactics to promote EMS provider participation. Develop a legislative agenda for procurement of funds related to trauma, direct and indirect, taking into consideration medical legal aspects, regulatory agencies, pressure groups, and current legislation. Establish system coordination related to access protocols, procedures, and referrals. These structures will establish continuality and uniformity of care among the providers of the trauma care. Promote internal communication as a mechanism for system communication, which will include EMS providers, consumers, and members of SETRAC. Create a system efficiency for the patient and programs through continuous quality improvement programs, which will identify the patient's needs, outcome, data, and help develop standard uniformity. This was our service area. From Nacogdoches to Matagorda. And right here I was in the city of Wharton when I was assistant chief. When I came in, I had always been an instructor. I taught things. I had the American Heart Training Center for this whole area, which was a big deal. American Heart back in the day, you couldn't do anything unless you had an American Heart. Doctors, nurses, EMTs, paramedics, everybody that was in healthcare needed American Heart, and I was the guy. And then I started teaching college, but while I'm here, I taught everybody, and then I was captain on the ambulance, and I was assistant chief on the ambulance. I was a HIPAA officer. I was everything. But I wrote protocols, and that was my big deal. I wrote protocols, and I would take it to my doctor for okay. Like I wrote a protocol up on fentanyl. And he says, Doc, he didn't call me Doc. He said, does everybody else do this? Is this correct? I said, yes, sir. And then he stamped his signature of approval on it because I knew what I was doing. I also wrote the Ebola protocol. And I'm going to refer back to this for a minute. Give me just a second. So I'm reading the news this morning, and I see the deadly disease outbreak kills 2,000 as experts reveal what Americans should know. What you should know is nothing that has to do with this, right? This is all fluff. What it says is you don't have to worry about it. Let me tell you what, I wrote the Ebola protocol, and this happened. We got 2014 crisis, okay? And we had some people that come into the United States that had Ebola. Y'all remember that? I sure do. And they got flown in. And do you know who did not catch Ebola? Was that they flew these two guys in, or whatever it was, from Africa. They flew them in, and the ambulance picked them up. Y'all remember? Flew them into Dallas, picked them up on the ambulance, took them to that fancy hospital over there, put him up there in a big confined ward. The nurses said to the paramedics, "Hey, what are y'all going to do?" They said, "We're going to go eat a burrito," and they took off. The two nurses went upstairs, and they got Ebola. Y'all remember that? They'll say it right here, and I'm going to post this link so y'all can read it. The treatment challenges. Well, let's see if they got it. And I'm going to tell you why. Well, it's in here. And I'm going to tell you why this whole piece is bullshit, because they told Americans not to worry. Don't worry, don't worry. There's 5,000 people that's already caught it over there, and they don't know how long people's been out of the country. Or, hey, we know Africa's poor, but we all watch movies too, like all that crap escaping. I know this for a fact, folks. I know this for a fact that Ebola has an incubation period of 2 to 21 days. Typical symptoms occur. I'm not going to tell you how long it takes to get on an airplane, or even I know Trump's shutting down the borders, but I seen a movie one time where a monkey came out, a monkey, and jumped the fence and spit in somebody's eye. I spit in your eye. When Ebola is catchable, you can catch it, is when they have a fever. I got the fever for the flavor. And they start spitting up and coughing. I hate coughers. If you ever catch anybody coughing in public, you need to stop them. I'm sorry, I shouldn't have said that. If you ever see anybody spit a coughing in public, you need to run the other way. Yes, run the other way. I've already started reinvesting in masks. I've been saying for 20 years that the flu is gonna kill everybody, and we got lucky with COVID, folks. I'm telling you, I was retired. I watched it coming over in December. I called all my family and I said, "Hey, look, we got this stuff coming over here, and you need to go to Lowe's and get your mask." They didn't even know what they was buying. They just know that I told them to go get masks. You better stock up. Ebola. Hey, also, while I'm at it, for you Gen Xers and older, Be glad you got your polio vac. I have mine. I got scarred. You can go get a tether, tether, test, test. You can go get your levels checked. That's what I'd suggest everybody do. Uh, anthrax got most of the cows, but y'all be safe out there. And if anybody gets around you with a cough and they got a fever, how you know they sweating like they done stole something. Anyhow, y'all be safe. Oh, I was going to finish up. Well, so let me tell you why those. So when I made the protocol for Ebola, and I wish I had it still, uh, it's at the city of Wharton. I got it somewhere. It's on the computer, but I gave that life up. Um, I wrote the protocol for Wharton, which extended to all these counties. And as we read from the mission statement and our goals, is that we collaborate and share our research. So, I made the protocol for this guy, and all these guys took it, and then the whole state of Texas took it. I remember being on a line with everybody in the state over Ebola, doctors, the whole 9 yards. And they had me if I had anything to add, and I said, "Who's got the prescription pad?" They laughed. The lady sitting beside me, she was a training officer for this county right here. It's a pretty big county, and she had the same experience. It makes me sad. I get upset when I think about it. Me and her, me and her sit, me and her sit beside arm in arm in a mini set track meeting, and she committed suicide, and that was horrible. I know everybody here. I know everybody here. I know everybody here, 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 and then that's where it kind of ends for me. But and then I started teaching college, and you think the state of Texas is really big? Well, there's a lot of empty space in Texas, and EMS is very small. And I know every EMS instructor in the state of Texas, and none of them have seen me on YouTube. I don't know why that is. Maybe that's a chosen thing. Anyhow, that's my story, and I'm sticking to it. And if you made it this long, God bless you. Please like, share, and subscribe. This sure will help my channel grow. I'm so poor I can't pay attention. God bless y'all, and y'all have a great day.